So this research really started because Dragon Claw Charity was observing that many people in the patient community were not experiencing optimal disease control, despite the introduction of these new treatments that have given physicians more tools in recent years. So the goal of our research then was to understand what factors may encourage or discourage patients from starting new treatments to gain a deeper understanding of what might be causing this potential treatment gap. So we originally thought, or the Dragon Claw team originally thought, that patients may be hesitant about new treatments or concerned about potential side effects, and this might be a key factor impacting treatment decisions. So to explore this topic, we conducted an online survey with nearly 150 people in Australia. And in order to be eligible to do the survey, participants had to be experiencing moderate to severe disease activity, which we assessed using patient-reported outcome measures. So we used a specific method called a discrete choice experiment to understand how people make treatment decisions. Essentially, patients are shown hypothetical treatment scenarios and are asked to choose between the options presented. And then we use statistical modeling to determine what factors are actually driving their decisions and by how much. So interestingly, we found that risk of side effects was actually not having as big of an impact as we initially thought it would. We found that patients generally cared more about feeling better and were willing to accept both severe and minor side effects in order to achieve this. For the majority of participants, chance of symptom improvement was the most important factor and significantly outweighed risk of side effects. So if it wasn't side effects like we originally thought, what was having a negative impact on treatment decisions? Well, we found that cost and needle fear were both important factors. In fact, for some participants, average monthly out-of-pocket costs had the biggest influence on treatment decisions. And we also found that when participants reported a higher level of needle fear, then those individuals were understandably more averse to injection or IV-based treatments, which, as we know, are the primary administration methods for biologic treatments. Findings from other parts of the research suggested that a lack of awareness for available treatment options, along with not having treatment regularly reevaluated, may also be key issues. So, for example, 34% of our sample told us they'd been on the same treatment for more than 1 year, including the exact dose and combination of medications, despite having moderate to severe disease activity. We can infer that it's difficult for patients to advocate for themselves and request treatment reevaluation when they don't know what options are available to them. And about half believe that there were hardly any or only a few treatment options available. We found that awareness for advanced therapies like biologics and JAK inhibitors was particularly low. So there was this potential awareness gap or need for education, but I really want to emphasize that the patients we spoke to were really keen to learn more. So the majority of patients stated that they wanted more information on what treatment options are available, how treatments work, and how their disease affects the body. We also conducted in-depth focus groups along with the online survey, and I think some findings from the focus group really add to the survey results. So a key theme that we were seeing in the focus groups was that many people were experiencing treatment fatigue after this sort of trial and error process with their medications. So this is when they had tried multiple treatments, still hadn't reached sufficient disease control, and this led them to feel frustrated or disillusioned. And we have a couple quotes to demonstrate that experience from the patient perspective. One person said they felt like a guinea pig because all these different treatments were being tried and they didn't know if one of them was going to end up working. So understanding what treatment options are available, as well as having information about the effectiveness of therapies like advanced therapies, might help patients feel more hopeful about the future and more willing to stay on that difficult treatment journey. And we have a quote that, again, I think demonstrates this very strongly. This person said, "The right engagement with medical professionals can help you feel that there is treatment options out there and that it's worth continuing on that path of trial and error because it's pretty demoralizing and costly and challenging each step of the way." So this was a super brief overview of the research, but if you're watching the recording of this webinar, you can scan these QR codes to get some more information. And I just want to say a really big thank you to the whole research team. It's a very collaborative process, and we're grateful to everyone who's involved. Now I'll just pass it over to Charmaine now from Dragonclaw.
Thank you, Maya. That was a very good summary of the research and our results. And what I want to do now is share with you the significance of these results. So rheumatoid arthritis affects more than our joints. And that is true of all the autoimmune conditions. So it's very important to control the chronic inflammation, to prevent damage, but also to lower the risk of other complications arising. For example, just by having RA, I have twice or 3 times the chance of having a cardiovascular event, meaning a heart attack or a stroke. So it's very important to get the inflammation under control and also to look at lifestyle factors that would reduce the risk. Now, you might have heard of treat to target approach, and it's actually only a feedback loop. And you get your first medication for your illness, but before you leave the office, you should also have a return appointment for reassessment, because you need to know that there are more options than the first medication offered. It is a bit of trial and error. But for rheumatoid arthritis, you usually get reassessed after 3 months, 3 or 4 months. And if the medication is not working sufficiently, it's added to or changed. And that holds true for all autoimmune conditions. And the feedback loop continues like that until you are controlled. The benefits are obvious. You get higher remission rates, and the patient is involved in their care, which brings us to shared decision-making. To have shared decision-making, the patients need to understand that there's more than the first medication they're offered, and they have to have an understanding of the treatment pathway. And then there should be doctor-patient collaboration, and that's when the patient can bring up such things as the needle fear, which was important for some, or cost concerns, or even if there's overseas travel that might be coming up in the near future. And this shifts the patient from victimhood to management. So these are a summary of the key study implications, and I think there's a big opportunity to enhance the shared decision-making process. So I'm going to share with you a couple of tools that Dragonclaw has been involved with. The first is called Know Your Numbers. And this is a list of the probable tests that patients with autoimmunity should be keeping an eye on. And we've also described in plain English what the tests are for. This is available on our website. It's endorsed by the Australian Rheumatology Association. You can download it for free. You can download it as many times as you want and keep track. The next tool we're working on and is about to be launched is called Impact, My Pain Assessment Communication Tool. This was done by an international group of patients living with chronic pain, because that is somewhat common with autoimmune conditions. And it shifts from the 0 to 10, which patients find inadequate, to how the pain impacts our lives. And hopefully that will lead to a conversation with your clinician about goals. And of course, we have our weekly Dragon Talks. There are 2 sessions every week. The facilitators are responsible for getting informed presenters. It's in real time. You can come if you're interested in the topic, and there's always time for support and sharing. And I just have a short clip to play for you about Dragon Talks.
Welcome to MyFlareUp and today's Dragon Talk. As someone living with lupus symptoms, MyFlareUp provides a community that understands life with a chronic autoimmune condition. Through online connection, education and support, we share experiences,
Nice to meet you all.
learn from global experts, and take control of our health. Now let's start today's session as we hear from Professor Eric Morand.
So the starting point is to understand why in a healthy person does the immune system not attack the kidney.
Welcome to Kathy Satori.
We're going to cover today how medicines actually reach patients.
And over to you, Estella.
When you are being seen by your provider, it's all about you. It is okay for it to be all about you.
Through our online autoimmunity community, I've learned how to prepare for doctor's appointments, look after myself better, and stay informed on new treatments without any pressure, just support.
How far off are Treg trials for autoimmune patients?
We think we'll do our first treatment of a human with lupus in early 2026.
I see a clinician about 5 times a year, but Dragon Claw has been my support for the other 360.
Well, that makes sense.
Catch up on past sessions online and join Dragonclaw for free if you haven't.
After a long time, I can finally live well with my autoimmune condition.
Please spread the word to patients, carers, and anyone you know who could benefit from being part of our community.
Thanks, everybody. Bye, everyone.
Take care, and we'll see you next time.